Welcome back to Mice TV, coming to you live from the CAKE PIE Expo in Da Nang, Vietnam. Our next guest is Dr. Daddi Fadel. She's a clinical scientist at the Center for Ocular Research, well known as CORE. She has more than 20 years of experience, and she's internationally recognized as a key opinion leader in the industry. Dr. Fadel runs an optometry practice specializing in contact lenses in Italy, where she personally designs and fits customized scleral lenses. She's here to talk about scleral lenses and dry eye today. Let's welcome her to the show. Thank you for being here, Dr. Fadel.
Thank you for inviting me. It's such a pleasure to be here.
Yes. And how are you doing today? How long have you been in Vietnam?
In 3 days, this is my third day, and I am so excited. I love Vietnam.
Oh,
yeah.
So I know today we finally got some sunny weather. I know the weather's been a little bit rainy the past few days. Were you able to visit any of maybe the attractions or the sites?
Very little, because I was involved here in the meeting. I had different meetings, but yeah, the little I saw, I just love it. I love the food.
So do I. What has been your favorite so far?
Oh, I don't know the name, so please don't. The balls. I love the balls, the crispy balls.
Oh, okay.
Yeah, I don't know what their name.
It's not bun chai, is it?
Bun Cha Hanoi has that.
Yeah.
But anyway, we could go on about food all day.
Yeah.
So let's get right into it. So let's talk about scleral lenses. What makes these different from your standard contact lens?
Well, first of all, the material of the lens is rigid and the large diameter of the lens. So the combination of both rigid lens and large diameter make them unique because they touch only the conjunctiva of the ocular surface, not the cornea.
Okay.
The cornea is the most sensitive tissue in the whole body. If you have only one eyelash in your eye, you will feel it because the cornea is very, very sensitive. If you will have it on your skin, you will not feel it. So by touching the cornea, the lens will be felt by the patient. The scleral lens will vault over the cornea and touch on the conjunctiva, which is very less sensitive. So it provides comfort, and just because of the rigid material, the lens will not conform to the cornea. So it will vault it, and there will be a space between the lens and the cornea, and this space will be filled with fluid reservoir.
Okay.
This fluid reservoir will correct the irregularities of the cornea and also will moisten and lubricate the ocular surface during all time. So that's why dry eye and ocular surface disease may have a lot of benefit from scleral lenses.
That makes a lot of sense. Well, so you mentioned dry eye. What types of patients can really benefit most from these types of lenses?
Well, all patients, also high myopia or astigmatism. My husband has normal cornea, but he is presbyopic, so he needs some multifocal lens for near vision, and he was very unhappy with soft contact lenses because of unstable vision.
Okay.
I tried for him scleral lenses with multifocal optic, and he loved it. So all patients can benefit from scleral lenses, but there are two main categories.
Okay.
Keratoconic patients, because of the high irregularities, and especially advanced keratoconus who have the only option keratoplasty. So now scleral lenses, just because they can vault over the cornea.
It has that room where the cornea is steepening.
Yes.
There's room for the cornea to be there.
Exactly.
Okay.
So we can make them high because we are landing on the conjunctiva, so they can benefit from this, avoiding undergoing keratoplasty.
And that seems like something that you would want to do. You don't want to have a major surgery if you don't have
Absolutely
to.
not.
You
Also
can correct
because
it with a lens.
Yeah. Also because keratoplasty will not ensure you a good vision or a success of the keratoplasty. The graft may fail. You may reject the graft, and after graft, up to 51% of patients will need corrections. And this correction most of the time will be scleral lenses. So it's better to keep the things simple and fit them before and avoiding keratoplasty, because you will complicate the fitting after.
Right, that makes a lot of sense.
Yeah, and the second category, so the first category, keratoconus, and especially advanced one. The second one, ocular surface disease and dry eye.
Very good.
So sounds like it has no weaknesses, but what are some of the downsides or maybe complications associated with scleral lenses? Is it for everybody, or?
Yes, it is for everybody. The main thing is, the main complication, it's not complication, the main difficulty in these lenses is handling.
Okay.
Because they are large, you need to open the eye very wide to apply the lenses on the eye. So, and also removing. So for this, scleral lenses need to be educated. So the patient need to be educated very well on how to apply and remove the lenses. And the time for education is crucial in these cases. You will resolve many problems due to the handling, but there are different complications like air bubbles, just because of the application technique was not optimal. And other complications, midday fogging, so the accumulation of debris behind the lens.
Okay.
This is unique to scleral lenses. So we may have these complications with soft contact lenses and also corneal lenses, but because of the renewal of the tear behind the lenses, of the tear exchange behind these two lenses, we don't see them. Scleral lenses seal the fluid behind the lens. So whatever the eye is producing, it will be entrapped behind the lens. Ocular surface diseases and dry eye are more prone to develop these debris behind the lenses. But now we have so many options to resolve these problems, from the fitting design, so just changing the design, and also we have new solutions to fill the lenses with. And these solutions has nutrients. They have electrolyte. So there is at least one study lately showing that using this new solution will reduce midday fogging.
Now, is that in essence almost making the scleral lens a drug delivery device?
Absolutely, yes.
Right.
This is is already available, and it will be the future of scleral lenses.
No, that's amazing. Now, let's talk about, we talk about fitting these lenses. You have the standard contact lens exam. How does fitting scleral lenses, how does that differ? Is it more complicated, and are there worldwide standards, or does this vary by country?
So there are standards, not too much complicated. Who is used to fit corneal lenses, the process is likely similar. So you need to understand the topography of the sclera in this case, because you are fitting on the sclera. However, there are two main fitting process. The process in fitting with a diagnostic set. So you have lenses, you put these lenses on the eye, and you assess the fitting of these lenses on the eye, and you make the changes. Or you take the scans and you do an empirical fitting. So you will order the first lens for the patient's customized one. Once you will have this lens, you will apply it, and then you will make some very small changes. So you will gain time, you will reduce chair time, and you will reduce the lens reordered.
Okay.
So two main process to fit scleral lenses.
Okay. Now, I know that there are a few misconceptions when it comes to scleral lenses as well. I think it's rumored that maybe they're not as comfortable, or maybe they cost more, but it seems to me that if you have some of these conditions, the benefits kind of outweigh any of that. Can you address some of those misconceptions that people might have?
Yes, there are so many misconceptions about scleral lenses. So for keratoconic patients, ocular surface diseases, they would pay whatever it costs to have some release and to have good vision. So this misconception may be related to patients who may have other typology of contact lenses, like soft contact lenses, astigmatism, or multifocal lenses. However, the scleral lens will last between 1 to 2 years.
Oh, wow. So you're not replacing them every single day?
No.
Okay.
So if you do the calculation of your spending for soft contact lenses,
I know how much I spend each year on soft contact
lenses. For 2
lenses.
years, you will see. So maybe with lenses, you will reduce the cost. So.
Okay. All right. So maybe, it actually saves you some money.
Absolutely.
Okay. Well, that's great. Is there anything else, any other final messages that you would like to share with our audience before we sign off for this segment?
So come to Vietnam.
Yeah, definitely.
So this is regarding Vietnam. I was so excited. I'm moving in 10 days, actually. In 31st of August, I'm moving to Canada. But
wow.
I definitely wanted to come in person to Vietnam because I love it as a country now. Seeing it, I definitely don't have other options. Just ask a practitioner in their country and investigate if they can do some customized lenses, if they have different problems with their eyes. So there is a solution for every condition.
That's right. Well, thank you again, Dr. Fadel, for joining us.